Assalamualaikum warahmatullahi wabarakatuh. My name is Shukrina. My matrix number is 081743. And right now, I am going to critique this image. This image is from epi-shoulder projection and it is an external arm rotation. This is because we can see that the greater tubercle is in profile laterally, while the lesser tubercle is seen superimposed with the head of the humerus. In this image, glenoid fossa is visualized. Next, the superolateral of scapula is seen without the thorax superimposition. For the positioning error, we can see that the clavicle is not demonstrated horizontally. Plus, the superior of the scapular angle is not superimposed with the mid of the clavicle. So, it indicates patient tilt anteriorly. To correct this, patient need to depress their shoulder and need to move slightly backward until the MCP parallel to the IR or the epicondyle parallel to the filum. For the alignment between X-ray tube and part, the central ray is not fall at the correct centering point, which is 2.5 cm below coracoid process. For the IR and part, the distance of collimation in the edge of the filum on top with bottom is not equidistant. Same goes to the left and right side. And lastly, the alignment between IR and X-ray tube. The central ray of the projection is not fall at the correct centering point of the filum. We move to the collimation. The collimation here is good because it includes the superior part, which is scapula, and the lateral part, which is lateral skin margin, is included, and the inferior part, which is represented by 1/3 of the proximal humerus. Next, we move to the exposure. Optimum exposure factor is used, which is 75 for KVP and 16 for MAS. So it indicates good contrast of thick structure, which is bony cortical outline of the acromion. And for the thick structure is bony cortical outline of the coracoid process or glenoid fossa. Adequate density can be shown by the thin structure of bony trabecular pattern of the acromion, while the thick structure is bony trabecular pattern of the coracoid or glenoid fossa. For the marker, there are no markers to represent the site of the interest. For A, there are no artifacts found in this image, and correct size of IR is used, which is 18 times 24 cm lengthwise. And last but not least, for the patient ID, patient name, date of examination, and place of examination are not stated here. All in all, this image is rejected because there are no marker, no patient ID, no date of examination, no patient name, and no place of examination here. I think that's all from me. Thank you.